Welcome to Ultimate Skincare and Beauty Report. I'm Mary Winkenwerder. Have you ever wanted to roll back time? Many wish they could, as rolling back the clock means looking younger. Rolling back 10 years seems to be the most popular number. If there was a way to look 10 years younger, would you accept the challenge? Joining us this episode is Dr. Cynthia Elliott to share with us how we can look 10 years younger using non-surgical cosmetic medicine. Dr. Elliott, welcome to Ultimate Skincare and Beauty Report.
Thank you, Mary. Thanks for having me.
It's great to have you join us. All right, so looking 10 years younger can be making a dream come true for so many people. How can we do this using non-surgical cosmetic medicine?
It all depends on the person. Because when I'm looking at you, you would be difficult because you look really good, and nothing stands out to me that would be something that would be correctable.
Thank you.
I look at other people, sure. When I look at other people with brown spots, patchy pigmentation, a lot of broken capillaries on their face, or they're starting to lose some volume and they're getting depressions and shadows under their eyes, lines, that kind of thing. Those are all things that are actually really simple to repair, and maybe people don't realize that. But using a combination of skincare products for texture and color, we can use devices like pulse light or laser to take away any broken capillaries or brown spots. We can use chemical peels, and even with no downtime, really improve the texture, the pore size, the brown spots, and then the dermal fillers to fill in the lines. So between a combination of those things, we can very simply, and sometimes in just one session, take at least 5 years off, and often 10 years. Because when someone's skin color is all even, that makes them look younger. And when they've done studies where they look at people who, they'll do computer-generated faces and put lines on one and a lot of brown spots on the other, and then have people guess the ages. And they'll guess both of those people as older than a face without either. But it's interesting because they'll guess that the person with the brown spots is older than the person with the wrinkles, which I thought was kind of a surprise.
I would think that the person with the wrinkles would be older, or appear to be older visually than the person with the brown spots, because the brown spots you can actually cover up.
Right. I think if you can see the brown spots, and if they don't look like freckles, when they start to look more like H spots.
Okay, so it looks more like okay.
Right. But it's just kind of surprising that you make this judgment in your head with just a second's glance, and you already have an idea of how old you think that person is.
Right.
Or you take the brown spots off, or you fill the wrinkles, and now they look so much younger.
That's amazing.
You do without surgery.
So, all these non-surgical procedures, what all do these procedures entail?
With the dermal fillers, it's injections, and most of our fillers now have anesthetic in them, so it could be a lunchtime procedure. They come in, we use a little ice for anesthetic, and the anesthetic is in the product. We inject it, they see the results immediately. The worst thing that can happen usually is maybe a bruise.
Mm-hmm.
They don't usually swell much, so a lot of times they can go right back to work, so it's pretty straightforward. Into lasers and pulse light, they can be red for a few days. If it's really an aggressive treatment, they may basically want to stay inside for a week, because it can be they can have that much redness and actually some oozing or crusting. And so obviously they may not want to work, if they work with people, when they have that kind of appearance. So it all depends on what kind of treatment is going to get them to their goals.
That's awesome. And I'm sure it would depend on the individual as well.
Yes, exactly. Plus their goals, their downtime, and the shape their skin is in.
Yeah, that's a huge factor in that. So what all does a patient need to do to prepare for these non-surgical procedures? Is it like preparing for surgery, where they have to enlist others to help them, or how does this work?
It is something that's very straightforward. It's nice if they can stop anything that would make bruising worse. So if they can stop aspirin, anti-inflammatories, that kind of thing, and stop that a week ahead of time, that's great. Ideally, if we're going to do a laser procedure, it would be great if they did a lot of exfoliating in the week before.
Okay.
But a lot of times people don't, or we just decide to do it tomorrow. So it's not that important. But there are some things they can do to kind of prep their skin for it. Using Retin-A or a tretinoin up until the time that they do it, I like that because I think that preps their skin. There are people who are a little more conservative who will have them stop, a week before. But to me, I want to have the freshest skin at the surface because I'm not going to have to penetrate dead skin to get my effect.
That's amazing. So in what time frame can we expect to see results, for each procedure? I know you said some of them, produce instant results.
The dermal fillers will produce instant results unless we're using more of a stimulating type filler that takes maybe a month to start to see a difference. But almost all the other dermal fillers that are actual fillers and not stimulants, we'll see the results immediately. They may look a little bit smoother over a week, but they usually look great as soon as we put it in. Pulse light or laser treatments, because the patient's usually they're usually red to start with, they're going to have to deal with the redness, and when the redness is gone, or if they flake or peel, it's after the peeling is gone that they really see the difference. But that's usually within a week.
That's incredible. So where can we catch up with you online to find out more about these non-surgical procedures that can make us look 10 years younger?
I think most of them are pretty well described on our website, and it's www.skinspirations.com. And I think we have a lot of pictures too, so I think it helps explain how the different treatments work, and it helps you choose what you think may be the best, and then we discuss it and customize it.
That's wonderful. Dr. Elliott, thanks so much for joining us. It's been great having you join us.
Oh, thank you, Mary. This has been fun.
All right. Catch up with me on my blog, www.beautyreport.com, and on Twitter, @BeautyPublicist. Everyone, thanks so much for joining us on Ultimate Skincare and Beauty Report. Have a beautiful and successful week. Mwah.